Hello everyone, and welcome back to UWorld's live NCLEX review. My name is Nicole, here with another question drill set just for you guys and you future nursing students. How a question drill set works is I will pull up a question right above me. I will read it out to you, give you about 30 seconds to read over the answers, and then drop in the chat what you think the right answer is, and then we will go over why the right answers are right and the wrong answers are wrong, and figure out better strategies and tips to get to these right answers. Sometimes the NCLEX can word them differently, word them negatively, positively. Maybe they have some keywords in there that you need to be paying attention to. But all of these tips and strategies we will go over and go along the way with our question drill. Today's topic is fundamental, so everything, the basics of nursing. So the foundation, everything builds upon these different concepts. So it might be a little easier for some of you guys because it is the foundation, or it might be a little bit more challenging because you totally forgot about it. But we need to have a solid foundation of the fundamentals. Today in the chat we have Nurse Samantha moderating, so if I go a little bit too fast with the answer choices or you need some reiteration on something, she will be there to answer all of your questions. So without further ado, let's get started. Hello everyone. Everyone's so chatty in the chat already. Loving it. Anyways, question number 1. The nurse is caring for a client who requires neutropenic precautions. Which of the following actions should the nurse take? Select all that apply. Option 1, request a prescription for intranasal influenza vaccine for the client. Option 2, place a surgical mask on the client during transport. Option 3, remove fresh flowers from the client's room. Option 4, assign the client to a private room. Or option 5, instruct the client to bathe daily. Let me know what you guys think in the chat for this very first question. Hello everyone in the chat. Someone says hi, Nicole. Hi, Miss Everest. Hello. Hola to you too. Hola, ¿cómo estás? I don't speak that well of Spanish, but Jasmine's been trying to teach me. I'm learning, guys. Hello everyone. I'm seeing lots of 2s and 3s. 2, 3, 4, 3, 4, 5. Good answer choices in the chat. Keep them coming. Like always, and like we say every single week, thank you guys so much for following, for tuning into our channel. We just reached 100,000 followers on our TikTok channel, which is so amazing. We are setting a new goal for the end of the year, and we just want to grow on all of our other platforms. So whether you're watching on Instagram, TikTok, YouTube, Facebook, we go live on many channels. All these are opportunities for you to get plugged in, a daily reminder that you should be studying for your NCLEX. So many ways to follow and stay in the know for all things NCLEX related. Good job, guys. I'm seeing lots of 2s, 3s, and 4s. Some people are including 5, but mostly everyone is getting 2, 3, 4, but we also should include that option number 5. Correct answers 2, 3, 4, and 5. So with neutropenic precautions or neutropenia is when a client has very low white blood cells. And white blood cells are very important, specifically the neutrophils, because those combat against infection and fight against infection in our body. So when we have low numbers of that, it is a lot harder for the client to fight off infection, and they're very prone to get an infection more easily. So we need to do everything to protect that client. Put them in a very safe and clean environment so they can protect themselves, and then make sure any other germs stay outside of their room, which is why option 4 is a correct answer. You want to have them in a private room so they do not share any germs with anyone else. Keep their germs and their immune system intact with everything around them, but keep everyone else's outside, which is also why option 2 is correct. Place a surgical mask on the client during transport for whenever they do leave the room. You need to protect them from any droplet contact that they may come in contact with. So protecting them by wearing that surgical mask will help create a barrier from that. Option 3 is correct as well. Remove fresh flowers from the client's room. Although they are pretty and the family will fight tooth and nail for this to have fresh flowers in the room, fresh flowers harbor bacteria, especially with the dirt that is around the stems. So we need to keep those outside of the room because bacteria leads to infection. And then option 5, which was a tricky one for some of you guys, instruct the client to bathe daily. A lot of people don't think that this is necessary, but the skin actually harbors, obviously, a lot of germs. So we need to keep the skin clean because that is the closest risk that they can get to get an infection. So bathe daily, as long as they're not using any harsh or drying soaps, bathing daily is highly, highly, highly recommended. Option 1 is incorrect because intranasal influenza vaccine is a live vaccine. And so we do not give live vaccines to any client that is immunocompromised, especially if they have a low white blood cell count, because they won't be able to fight off the infection or build the immunity to fight or to have that vaccine create a protective barrier for them. So that is why option 1 is incorrect. But very good job, guys. Let's move on to the next one. The nurse is planning care for a client who has an indwelling urinary catheter. Which of the following interventions should the nurse include in the client's plan of care? Option 1, apply tension when securing the catheter tubing to the client's inner thigh. Option 2, maintain the urinary drainage bag above the level of the client's bladder. Option 3, empty the client's urinary drainage bag when it's completely full. Or option 4, cleanse the client's perineal area with soap and water. Let me know what you think down in the chat. Good job, guys. I guess some people are just jumping on as well. Read the question, drop what you think down in the chat. Also, let me know if we have any recent NCLEX passers. I know last week we had a lot of people that were about to test this past weekend and then this following week. So if you are a recent NCLEX passer, I would love to give you a shout out. Also, if you're scheduled to take your test in the next couple weeks or months, give you a shout out as well. Wish you the best of luck or congratulations if you pass, or if you're waiting on your ATT, give you some encouragement with patience as a virtue. So let me know in the chat who we have today. I'm loving the rationales that you guys are putting in the chat as well. Good job. Susan said that she passed 40 years ago. Congratulations to you. Thank you for tuning in and just getting, staying in the know with all things nursing. Man Pete said pass the NCLEX in 150 questions last week. Congratulations to you. Welcome to the RN world. Brianna's testing tomorrow. Good luck to you. You got this. Way to get one last study session in. But tonight, get a good night's sleep. Rest well. Don't worry yourself. Don't overthink it. You're going to do great. Good job. Lots of correct answers, good rationales as well. And then someone said that they took their NCLEX today. I hope you did well. I know you did well. Llama's taking theirs on Saturday. Good luck to you. So, going back to the question, the correct answer is option 4, cleanse the client's perineal area with soap and water. I know someone says, whoops, I forgot to read the question. Yes, read the question very, very, very carefully because we need to know if this is a positively worded question or negatively worded question. In this case, it is a positively worded question because we're looking for a statement that we should include into the client's plan of care, meaning 3 of those options are going to be wrong teaching points. Option 4 is the only correct teaching point, which is cleansing the client's perineal area with soap and water. When a client has an indwelling urinary catheter, they are at an increased risk for urinary tract infection because they have an external source continuously in them creating a portal of bleeding that bacteria into their urethra. So we need to make sure that that area stays very, very clean. I'm sure hospital protocols, you've heard them many, many times before for CAUTI. We take that very seriously because it could cause some serious infection, but not just UTIs, but can lead to sepsis as well. So cleansing the client's perineal area with soap and water is the best practice. Think about taking a shower. You take a shower daily, at least I hope you do. And so that area definitely needs to be cleansed with soap and water as well so it can inhibit bacteria forming at that entry point. All the other options are incorrect for a certain reason. Option 1, apply tension when securing the catheter tubing to the client's inner thigh. Well, yes, we need to secure the client's tubing to the client's inner thigh. We do not want to apply tension because that can cause pain, but then it also can cause tension on the actual sphincter, and it can actually have the balloon pull out and cause more complications later. So don't apply tension, apply a little bit of slack, but still secure it to that inner thigh. Option 2, maintain the urinary drainage bag above the level of the client's bladder. You always want to maintain it below the client's bladder because you don't want that urine to backtrack back into the client and cause a UTI. So keep it below. Even if they're walking down the hallway, hook it onto their walker or just hold it dangling below the client's bladder. And then option 3, empty the client's urinary drainage bag when it's completely full. When it's completely full, that is too late. 1, it's probably going to be very, very heavy. But 2, again, it can backtrack back into the client and cause an infection. So we always, best practice, encourage you to empty it when it's at least halfway full, sometimes even more or lower at 1/3 full, but never let it get completely full. Very good job, guys. Question number 3, the nurse is screening clients for those at risk for developing pressure injuries. The nurse should recognize the client at highest risk for developing a pressure injury is the client who what? Option 1, frequently slides down in the bed. Option 2, is experiencing constipation. Option 3, has an indwelling urinary catheter. Or option 4, ambulates with a walker. Let me know what you guys think down in the chat. Also, shameless plug, I like to let you guys know about all the cool features that we have at uworldnursing.com. We have question of the day and also question of the week that can be sent to your email box separately. So you can test in the comfort of your own home without any other outside noise of telling you what to do or telling you how to think about the question, but a question directly to your inbox personally for you every week. Then we also have great other UWorld features within the subscription when you buy, whether you do a 30-day subscription, 60-day, 90-day, or if you do the 7-day free trial. We have flashcards, we have lectures, we have multiple practice questions, whether they're just our regular question or NGN questions, which are super helpful now that the NCLEX is definitely more interactive with NGN type questions. So get plugged in, go to uworldnursing.com to see these fun features. Good job, guys. I'm seeing mostly ones and a couple of 3s. Good job, good job. And the correct answer would be that option 1. So these questions can be a little difficult because technically there might be a reasoning for why each answer choice could have been right. But you kind of have to, with this type, put them against each other and kind of count how many factors would make the one client at the highest risk. So option 1 would be our correct answer because a client that frequently slides down on the bed has the actual impact of that pressure injury actually happening. It puts them at the highest risk because they're having that friction and shear with their body sliding down against the bed. So they're actually having that contact creating that pressure injury. All the other options could potentially lead to it, but it doesn't have that actual direct contact. So option 2, the client is experiencing constipation. Well, this might make you think in your mind, oh, that means they're probably not walking around, they're very still, they might be immobile. We can't add to this situation. So experiencing constipation, that doesn't mean that they're actually going to develop a pressure injury. It could increase the risk, but it's not the highest risk. Option 3 is the same way. Just because they have an indwelling urinary catheter and they're not getting up to go to the bathroom, doesn't put them at direct risk for that pressure injury because it's not having anything to do with their skin directly. And then option 4, ambulates with a walker. This is actually a good thing and probably decreases the risk entirely. If they're getting up and walking around, that's going to decrease, get that pressure off of their skin and prevent them from having that pressure injury. So sometimes when it's asking you for the highest risk or the highest of something or the most of something, you kind of have to compare them against each other and maybe count the different factors that would lead to whatever the question is asking for. So in this case, the highest risk would be the one that actually has that direct contact to create that pressure injury. Good job, guys. Question number 4, the nurse is talking with a client who has a colostomy. Which of the following statements by the client would require follow-up? Option 1, I should avoid drinking coffee and alcoholic beverages. Option 2, I need to chew my food completely before swallowing. Option 3, I can continue to swim in the pool every morning. Or option 4, I will wait until my pouch is full before emptying it. Let me know what you guys think in the chat. Don't be afraid. We love to get talkative here in the chat. Someone was like, this is a repeat from today. Yes, we do repeat our lectures within the day. So I went live at 11 a.m. Central Time, and I'm going live again, 3 p.m. Central Time. And then Nurse Andrew actually will be covering this as well tomorrow evening at 7 p.m. Central Time. So this is my time where I can tell you the many times we go live just for you guys to get plugged in. We go live, I think 7 times a week, 5 days a week. So there's many opportunities for you to get plugged in. Starting Sunday evening with Nurse Andrew. Then we have a lecture on Tuesday at noon, 12 p.m. Central Time. We have a question drill on Wednesday at 11 a.m. Central Time and 7 p.m. Central Time. On Thursday, 11 a.m. and 7 p.m. And then on Friday at 7 p.m. as well. So multiple question drills. Then we have some lectures. Earlier this morning, someone was asking for concept maps. I think we're going to start incorporating, or they were asking for case studies. I think we're going to start incorporating the concept maps again because you guys really enjoy those. It gets you a full picture of a diagnosis, which is very helpful, especially with those NGN type items that make you think with risk factors, interventions, follow-up, evaluation, seeing the whole picture of things. Good job. Someone is asking, how often do we go live? I just did my whole spiel. If you want to see our full event calendar, we do have our full event calendar with the actual specific topics that we go live at uworldnursing.com. That's usually the very first thing that you see is the event calendar for the next 3 weeks and the specific topics that we'll be covering for every single day. Good job, guys. I'm seeing unanimous, pretty much everyone choosing 4, and that is the correct answer. So we had to be very careful with this question because it is negatively worded. Which of the following statements by the client would require follow-up? Meaning we're looking for an incorrect intervention and something that we need to stop from happening so it doesn't prevent any complications. Excuse me. So that is why option 4, I will wait until my pouch is full before emptying it. So with a colostomy, just like a urinary drainage bag, we want to empty it before it is completely full so it can reduce the risk of any contents backflowing back into the client. But with a colostomy especially, that can sit and irritate the stoma and irritate the skin around the stoma. So we need to empty it before it is completely full. As well as we don't want that colostomy bag to pop or anything, especially when you have a lot of actual solid, you can have a lot of gas expelled as well. So we frequently actually need to monitor that so we can, what I call, burp the bag to make sure all that gas leaves the bag, and so there is actual room for the stool contents. Options 1, 2, and 3 are correct things that you can teach the client, or the client should be saying back to you. So option 1, I should avoid drinking coffee and alcoholic beverages. This is a true statement. Alcohol and coffee can sometimes increase that motility in the GI tract. And if you increase the motility, you might have excessive gas or excessive stool as well. So we don't want to have excessive of anything. And then emptying the bag can be a nuisance sometimes. So avoiding drinking it would be a good practice as well. Option 2, I need to chew my food completely before swallowing. This is a good statement. Chewing that food very, very well can limit the risk of obstruction. We don't want any obstruction from happening. So chewing it thoroughly will prevent that. Option 3, I will continue to swim in the pool every morning. This is okay. They can still live a normal lifestyle. Just make sure that the adhesive, whether it's the tape or the glue that is keeping the pouch on, is intact, so you don't have any stool contents floating around in the pool. But yes, they can have a totally normal life. So encourage them to go swimming like their normal daily routine. Good job. Someone was asking, when should we empty the pouch? Just like a urinary drainage bag, we want to empty the pouch before it's even halfway full. So I always say 1/3 to 1/2 full, time to empty the bag. For any of you guys who were not successful in passing the NCLEX the very first time, we have a special offer for you guys to help you pass this next time, because we know you got it. If you upload your CPR report, which is that report the NCLEX sent you after you were unsuccessful the first time, whether it was by email or by your mail, upload it to our portal. There is a retake offer button at uworldnursing.com, and we will email you back with a $20 off coupon code for 30-day NCLEX review using UWorld. We believe that UWorld can help you pass the NCLEX if you use it thoroughly, especially for 30 days. So this is our little token to you to help you pass, because we know life can be expensive. Paying for the NCLEX can be expensive. So this is our help to you. But it's only for those who were unsuccessful that very, very first time. Go to uworldnursing.com and upload your CPR report. We also put the link down in the chat for the retake offer as well. Question number 5, the nurse is observing a staff member administer eye drops. Which of the following actions by a staff nurse would require the nurse to intervene? Option 1, positions the client in the supine position before administering eye drops. Option 2, cleans the client's eye from the outer canthus to the inner canthus before administering eye drops. Option 3, gently pulls down on the conjunctival sac with non-dominant hand and instills eye drop with the dominant hand. Or option 4, repeats eye drop administration if the client blinks and the medication lands on the outer lid. Let me know what you guys think. Someone was saying follow-up is a negative question, so I suppose to take the wrong answer. I think that would be true. Negatively worded questions, you're looking for wrong interventions, things that we need to intervene. Good job, guys. While you guys are putting your answer in the chat, we are over halfway through, so now I can ask my favorite question that I like to ask every week, is where are you guys tuning in from? I love to see how far UWorld reaches in the world. You see what I did there? Love to see that. So drop in the chat. Let me see where you're tuning in from, whether it's early morning, late at night. Let's see where our viewers are from. Ohio, Mississippi, Kentucky, Kenya, Philippines, New Jersey, Kenya, Ghana, Florida, Nevada, Ontario, Canada, Ghana, Kenya, Germany, Chicago, Las Vegas, Eunice, Nigeria, St. Cloud, Minnesota, Kenya at midnight, good night, Jamaica, Philippines, New Jersey, Redondo Beach, San Diego, I would love to be on the beach right now, Bay, California, Liberia, Ghana, Florida, Jamaica, Las Vegas, Ohio, Colorado, UK, Massachusetts, Cuba, but I'm in Miami, Minneapolis, Nigeria at 10 p.m., Mexico, Phoenix, Finland, Alberta, UK, Dubai, New York, people all over. We're having a lot of international people on, so thank you guys so much for tuning in. I love to see truly, truly, truly where we're popping up all around the world. It's amazing. It's great. Thank you guys for tuning in, getting some NCLEX prep and some practice. We are here to help you. That's why we go live multiple times a day, multiple days a week, just for you. So thank you guys for tuning in. Okay, correct answer, like many of you guys put in the chat as well, it is that option 2. So back to the question. Which of the following action by a staff member would require the nurse to intervene? This is a negatively worded question, so we're looking for wrong actions. So a nurse that cleans the client's eye from the outer canthus to the inner canthus would be an incorrect thing to do. That would be bringing more bacteria from the outside of their eye back into their eye, which is a no-no. We want to always clean from the inside out, bring the bacteria and everything, draw it all out. All the other options are correct interventions or actions when instilling those eye drops. So position the client supine in the bed. This would be good because it's allowing gravity to help with us by having them lie down, and you can just drop it right into their eye. Option 3, gently pull down on the conjunctival sac, which is just pulling down on their eyelid and then dropping the eye drops with your dominant hand. That is best practice. And then option 4, repeat the eye drop if the client blinks. If the client blinks, that means that they're actually not getting that instilled onto their eyeball. So you need to actually put it on the outer lid or make sure it actually touches their eyeball. Not the tip of the eye drop container, but the actual liquid or solution, have that touch their eyeball, not if they blink. But you guys got it unanimously, option number 2. Question number 6, the nurse is preparing to administer insulin to a client. Which of the following actions should the nurse take? Option 1, draw up regular insulin into the syringe first and then NPH insulin second. Option 2, hold the insulin syringe with the non-dominant hand and pinch the peri-umbilical skin with the dominant hand. Option 3, clean the injection site with an alcohol swab and inject the insulin before the alcohol dries. Or option 4, check for blood return before injecting the insulin. Let me know what you guys think down in the chat. You guys are still putting in where you're tuning in from. So we got Zimbabwe in the house, North Carolina, Finland, and the Philippines, and Arizona, and Hawaii, and New York. Thank you guys. Thank you again. I don't know if anyone's tuning in from New Jersey, but we have Nurse Rebecca on the ground at the NJNSA, or the New Jersey Student Nurse Association Conference, meeting you guys in person. She's at the booth. We have a photo booth. You have the Question Jill Challenge. Lots of fun things. So go say hi to her. And then I think she's also there early in the morning tomorrow as well. So there's still time to catch the UWorld girlies down at the ground in New Jersey. Go say hi. Tell her I sent you. Blame it on me. That's totally fine. I get it all the time. Okay, correct answer, like a lot of you guys have put in the chat, is that option 1. So we went from negatively worded questions back to regular positively worded questions. So which of the following actions should the nurse take? Meaning this is what we do want the nurse to do. So drawing up regular insulin first and then NPH insulin is the correct order of drawing up insulin if you are mixing. I feel like nowadays we don't mix as often because we have those auto inject insulin pens now. But if you do need to mix the insulin, always remember you're an RN, so you should draw up the R, then the N. Regular insulin first, then NPH, or clear, then cloudy. You never want to cross-contaminate NPH because it is a longer acting insulin into the regular insulin. That's a short acting insulin. So regular insulin first, then the NPH. All the other options are incorrect for probably a very minor word, so read it very carefully. So option 2, hold the insulin syringe with the non-dominant hand. That would not be best practice. I don't know about you guys, but I wouldn't want anyone coming towards me with a sharp object with their non-dominant hand. I want them to be skilled and knowing what they want to do with their dominant hand. So hold that syringe with their dominant hand and pinch with their non-dominant hand. Option 3, clean the injection site with the alcohol swab. That's great, correct. And then inject before the alcohol dries. That would be incorrect. You want to inject it after the alcohol dries. So that one word changes the whole thing. It makes it wrong. Option 4, check for blood return before injecting the insulin. This is just straight up not best practice. You never aspirate any blood. You just give the insulin directly. Very good job, guys. Question number 7. The nurse is teaching parents at a community health fair about scoliosis. Which of the following information should the nurse include? Option 1, scoliosis affects only the curvature of the lumbar spine. Option 2, surgery is required to correct scoliosis. Option 3, screening for scoliosis begins in preschool. Or option 4, scoliosis can cause unequal shoulder height. Let me know what you guys think down in the chat. Someone was asking, what if we don't have our CPR report? You can contact the NCSBN or the NCLEX website directly because that is a requirement of them to provide to you is that CPR report. So they should get back to you in a timely manner because that is a requirement. Do not fret. Good job, guys. Also, let me know in the chat, what topics would you like us to go over? I asked this earlier this morning, and a lot of you guys, like always, will love to go over pharmacology. And a lot of people, we're also asking for those case studies again. And that's how we incorporate our concept map is a full case study type of question. But what other topics or maybe NGN type style things would you like for us to cover? Cardio, obstetrics, pharmacology. Don't we know it? Cardiology, med-surg, psychiatry, OB, chest tube, mental health, pharmacology, critical care cases. That's a good one. Good job, guys. It seems to be a trend to always want to do pharm, always want to do peds, and always want to do OB. Those are always the 3 hardest, and cardiology and ECGs. Those are just very meaty, hard topics to fully understand and grasp. Sometimes I still struggle. I definitely struggle with OB and maternity and everything, even though I am a woman. It's hard. Okay, correct answer for this one would be option 4. Scoliosis can cause unequal shoulder height. So going back to the question, figure out, is it positively worded or negatively worded? This would be a positively worded question. So we're looking for true statements, and you have to read them very carefully. With these answer choices, those definitive timeline words can set the whole question off. So option number 4 is the only one pretty much that doesn't have a definitive time. Scoliosis can cause unequal shoulder height, which is true. No matter where it lies in scoliosis, scoliosis is when you have a spinal deformity. So it can cause unequal shoulder height, or it can also cause unequal hip height because the lumbar spine is having a curvature that is not straight. That's the only correct statement. All the other options are incorrect for probably that definitive word. So option 1, scoliosis affects only, there's that definitive word, the curvature of the lumbar spine. This is incorrect. While yes, it affects the lumbar spine, it also affects the shoulder height and the hip height, and affects the thoracic and other bones in that lumbar spine. So not just only the curvature of the lumbar spine. Option 2, surgery is required to correct scoliosis. Required, that's that definitive word as well. It is not the only treatment plan for scoliosis. If you catch it early, those scoliosis clients could actually be put in a brace or do physical therapy and can help realign their lumbar spine. So it's not the only treatment plan. It's not required to correct scoliosis. So be very, very careful with those definitive words. And then option 3, screening for scoliosis begins in preschool. This is incorrect because screening for scoliosis actually occurs usually during their adolescent years. Think of the growth spurt years. That's when you have that rapid growth in a client. You have sometimes the unequal growth of certain bones in their body. So that would be the perfect time to start assessing the curvature and the growth of the spine. So that usually happens at adolescence. Preschool is way, way, way too early. Although sometimes they do get a little bit of a growth spurt then, their biggest growth spurt is usually in their adolescent years. Last question of the day. The nurse is teaching a client with orthostatic hypotension. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. Option 1, perform carotid artery massage. Option 2, decrease dietary sodium intake. Option 3, apply graduated compression stockings. Option 4, implement fluid restriction. Or option 5, administer fluticortisone. Let me know down in the chat what you guys are thinking. Also, how many right out of 8 you guys got right today? This one was a good fundamentals foundation, covered pretty much like every concept. So let me know. Was it an easy one for you guys? Would you want me to go harder? Last week, I think it was last week, we did most missed, so that one was a harder one. Now we did fundamentals, which might be an easier one for you guys. Seeing 2s, 3s, 5s, 2s and 4s. Read it very, very carefully. Which of the ones do you want to include in a client plan of care? Kind of break it down. What is orthostatic hypotension? And what do I need to do to encourage them not from, well, I can't say it before I give you guys the answer. Someone was asking a half mark even when you get everything correct. So with select all that apply and with the new NGN type NCLEX, you get partial credit for certain questions. So it's a plus and minus score with questions like these. So you get points for the ones that you get correct, and everything is graded based on this question's particular total score. So this question might be worth maybe like 5 points. So if you get all 3 of the correct right answers right, then you get all 5 points. But if you choose an incorrect option as well as correct options, that actually deducts from your question's total score. So it's a plus and minus for a specific question, and then this question score will add to your total score. So it's partial credit, but we always encourage you to choose the correct answer and only the correct answer. Good job, guys. Now people are changing their answers to 2s and 3s and 5s. But I think you should just stick with the 3s and the 5s, so that would be our correct answer. So orthostatic hypotension. So break it down. What is orthostatic hypotension? It's when you have low blood pressure, but it further plummets when you go from lying down to sitting up or sitting up to standing up. So you have a significant drop in your blood pressure, which causes these clients to get very dizzy, feel very lightheaded, and it's just a complication that can increase their likelihood to fall. So we need to do everything to maintain their blood pressure or increase their blood pressure. So that would be options 3 and 5. Applying those graduated compression stockings, that prevents the blood from pooling in their legs and helps push it back up to the heart to keep that adequate circulation going. And then option 5, administer fluticortisone. That is a synthetic mineral corticoid that mimics aldosterone. And so aldosterone reduces sodium loss in the urine, so sodium stays in your body. And wherever sodium is, water follows. So that increases your vascular fluid and that increases your blood pressure and keeps that blood pressure maintained. So that is a correct thing. So we're looking for correct options that would increase or maintain your blood pressure. All the other options would probably decrease your blood pressure. So performing that carotid artery massage. This is actually like a vagal type of maneuver, usually actually used to decrease your heart rate if the client is in SVT or something. Massaging that carotid artery or vagaling down will help decrease the heart rate. Option 2, decrease sodium, dietary sodium intake and limiting that fluid restriction, or implementing the fluid restriction. Again, like I said, water follows salt or sodium. So if we're decreasing the sodium intake, then we're not going to have a lot of water in our system. So our vascular fluid circulation is going to be decreased, which is going to further drop our blood pressure. Again, as well with option 4, implementing a fluid restriction. If you don't have enough fluid in your vascular system, then your blood pressure will drop. So options 3 and 5 are the only correct answers, but you guys did so good. So many people got 8 out of 8 and 7 out of 8. Congratulations to you guys. You guys did well, but come back next week where we'll try again and we'll try even harder questions for you guys. We go live multiple times a day, multiple days a week, just for you, doing question drills or lectures. But until next week, I will see you then.